Dr. Tom Potakar is a British surgeon and the director of Interburns, and Milena Chi is an intensive care specialist at the European hospital in Gaza, which was hit yesterday in those Israeli airstrikes. Both joining us now from the hospital in Khan Yunis. Good to have you with us. Tom, first and foremost, just tell us what happened in those moments, if you will.
Yeah, so last night we just finished operating. Milena was in the intensive care unit. I'd gone back to the residence, and then there was one extremely loud explosion, followed very, very rapidly by a number of others. I understand there was 9, I couldn't count, but yeah, certainly there seemed to be quite a few. Rushed outside to see a huge crater in the entrance to the hospital, quite a few wounded lying around, quite a lot of destruction to the hospital, inside, rubble on the floor, shrapnel, bits of ceiling coming down, water leaking from the roofs, and large cracks in the actual walls of the hospital building as well.
And Milena, just talk to us about your experience in that moment. What was happening for you?
I was in intensive care at this moment looking after a patient, and there was a very strong and loud blast and noise, and we could not stand on our feet, so we were thrown on the floor. The explosion happened just probably 2 meters away from the wall of the critical care, so there were some panels which fell from the ceiling and quite a lot of dust. It's a very shattering experience. It's quite scary, and even my colleagues are very used to it. Nevertheless, they were very scared and shocked. Maybe it is
2 more.
It is 2, 3 more at the moment. So this is my experience.
Just, if you will, how many people were killed and injured in this strike at the hospital where you were?
Sorry, there were 2 more, so we couldn't hear you. 2 more.
Sorry, there's quite a few blasts going on. Could you repeat that?
Just, if you will, how many people were killed and injured in these strikes that took place that you both experienced?
So there was reported 28 killed, and somewhere in the region, I don't think there's precise details about the number of injured, but somewhere between 50 and 70 from what I understand. The patients were not admitted, I think 1 or 2 here, but they were taken straight away to other hospitals because obviously people were extremely frightened. A lot of the staff were trying to flee, as were quite a lot of the patients. And nobody knew, if there was going to be further strikes, so they didn't want to be admitting patients. So the patients, and also the entrance and everything was blocked for ambulances. So the ambulances on the other side immediately took patients to other facilities.
What impact, Tom, has this had on the capacity for you guys to operate and provide healthcare provision and services?
Well, the moment the hospital is barely functional. There are still patients in the hospital, but the water supply has been affected, so there's no water on the intensive care unit. The operating theatre was the right outside was damaged with a lot of rubble on the floor and outside the theatre. The drainage has been affected, and the sewerage, etc. So it needs some structural repairs for those things, which will take some time. So there's not been any operating happening this morning. And obviously everyone's doing the best they can to look after the patients. Those that can be discharged have been discharged.
We talk about the patients. Milena, if you will, just talk to us about who is in your care at the moment and the care that you're having to provide. What injuries are you having to treat at the moment?
Intensive care is full at the moment. I have 11 patients. 3 of them are children. Majority of the patients that we look after have blast injuries to different areas of their body. So they are injuries secondary to explosions.
And to what degree are you able to provide care? You're thinking of the fact that there has been that aid embargo now on the Strip since the 2nd of March, the Israeli authorities not allowing aid into the territory. Where are you at with regards to the medical supplies and equipment that you need to be able to look after people?
Garrett, there is no medical supplies whatsoever. There is no tissues to wipe our hands when we wash them. Now there is even no water. They lack soap, cleaning materials, medications, monitors, supplies of consumables, whatever you can think about it. And is lacking. But I need to say that despite all that, my colleagues are absolutely amazing. They turn up to work every day at 8 o'clock. They are very polite. They are very considerate for their patients. They do what they can. And they all fulfill their humanitarian duty the same way as we are trying to do as well.
Milena Chi, intensive care specialist, Dr. Tom Potikar, British surgeon and director of Interburns, both speaking to us from the European Hospital in Gaza. Appreciate your time. Thank you.
Thank you.
Thanks.